Jim Augustine. We're here for another episode of DocTalk. The calendar's just converted to March. Extreme weather is still coming across the country, and we're going to be talking very quickly about spring weather conditions this year, and tornadoes and bands of tornadoes, and really extremes of weather that are really early in coming this year. With my Ohio roots, they're going through their third round of storms in the month of February, and two sets of tornado watches and in one case warnings. This is unbelievable. So maybe it's Mother Nature just getting this out of her system very early before we get into the period of time where long track, very destructive tornadoes can occur. Nonetheless, many of you are challenged already by spring weather conditions that are coming across. On the health side, I got to tell you, we haven't looked this good in probably 2 years. We finally are getting to the point where routine February medical care is going on. It's busy, but it's not overwhelming. And many of our emergency departments are in better shape than they have been in a couple years, really in terms of being able to move patients and not have EMS be lined up waiting to offload their patients, and where we have the emergency department staff with timely assessment, movement of patients going the way that it should go. So that is fabulous news for all of us. Let me take this week and the questions that have come in over the last couple of weeks. Let me take this week to look a little backwards. Essentially, for 2.5 years of doing this, we have been looking forward and what to plan for. In my last session, we talked a lot about, moving into the summer and into next fall, what to plan for. But let's take a moment to look backwards, because that's what's occurring now. And we should expect that. We're at a point where we're beyond the crisis, and we're able to have people begin to think through, in the future, how could we do this better? And really important for us to understand how this began. And so we have the opportunity now for a lot of bodies to go back to where we think this originated, which was around the area of Wuhan, China, and begin to assess how a novel version of a coronavirus could begin to take hold in a human population and then spread very quickly before it could be controlled. The reason to do that is so that in the future, we know how to look for bad bugs. We know how to assess when they could become major risks beyond wherever they started. And then what kind of control measures worked and didn't work. That will generate a lot of interest. And looking retrospectively, by the way, in the old retrospectoscope, it still doesn't have 20/20 vision. In other areas, we sometimes have 20/20 vision looking backwards about things we should have done or didn't do. When we're looking back in infectious diseases and Mother Nature, we still don't have perfect vision, and we never will. The headlines really recently have been around where this virus came from, and did it come from a natural mutation in animals that ended up somehow in Wuhan, or did it come from a research lab that's present in China that allowed a leak to occur somehow? That would be important because we have to have research labs. Just so everyone is aware, the only way that we move science forward in studying lots of things like viruses, bacteria, tuberculosis, Ebola, Marburg, other bad news, we have to have places that study them and in various ways look at ways to control them, and look at ways really that they could come out of control. And so we have biosafety labs, varying levels. Some of those are present in the United States, and we have to have them because we have to understand how these bugs move, or we let them do their natural work and we never study them, and then we would end up in serious problems. So we have had these same types of labs, BSL level 3 and BSL level 4, in this country for many years. and they do fabulous work. They get very good answers. They build science. They build prevention. They build knowledge of overall how the human body reacts to certain things, and we're all the better off. We have controlled terrible diseases, including smallpox and polio, based on the work that was done in those labs. And from the work in the labs, it led to vaccination programs, which led not only in this country to us eradicating those diseases, but all over the globe, we've eradicated those diseases. So that's why those labs occur. There is a place on the planet where viruses have a tendency to be more easily distributed than anywhere else, and that is in China. And that is why they have those labs doing that kind of work. And in many ways, their labs, because that's not the only one, focus on the work of respiratory spread diseases. Because in their population, which is more than 1 billion people, that is their biggest risk. There are 1 billion people living in very close proximity, and they have to have the knowledge of how to investigate, prevent, and mitigate and develop treatments for people who eventually do get that disease. So that's what that lab does. That is how natural work could have occurred and potentially allowed a leak to occur out into the public. There is no specific knowledge that that did occur, but one of the agencies in America that studied that said that they thought that that was a higher probability than other probabilities for the beginning of the Wuhan virus. Other United States and World Health and European and other investigative agencies have not found that same thing, and found that it began in animal reservoirs, and then it was distributed in a way that we've heard about before through what are called wet markets in China. So looking back, we have the opportunity to consider how this started, and then in the future be able to mitigate future respiratory diseases evolving as rapidly as Wuhan did. The second thing we've done is looked at the effectiveness of programs. How effective was the use of PPE? How effective was early use of medications of varying kinds? How useful was it to go into social isolation and do 6-foot distancing and wear certain types of masks, etc. We will now take a look at what we can learn from the retrospective investigations to say what could we do better and how can we do it better. All of you know that this was the first pandemic that occurred that didn't heavily involve children and children dying in particular. Every other pandemic on the planet has heavily affected children and affected them in a very negative way if them die, or were left with lifelong complications if they could have a long life. Which, for example, in polio, we had an outbreak of polio, heavily affected children. Many of those children died. Others were left with lifelong implications, and those children never could have a long life. And so we have a pandemic that has occurred with the coronavirus that did not heavily affect children, and it heavily affected elder people. And so what are we going to learn about the human immune system? So over the coming months to years, we'll hear more about why scientists believe it heavily affected the elder, didn't affect children, and what implications that have for future outbreaks. And if we have another coronavirus outbreak, what that would mean. If it was another outbreak of a similar respiratory virus, what that would mean. And then how we can build successful vaccination programs or other prevention programs that don't allow a future outbreak to have the impact that COVID did. So we are there. We continue to look at vaccinations and how they can be brought into the world for the COVID-19 bug. This week saw the publication of the first United States-based study on a nasal vaccine. Many of you love that idea. Spray it in my nose or make me swallow it instead of me having to get another jab. And I want you to know there's ongoing, very good work. And really the first report of success in the use of a nasal vaccine for this coronavirus. That work, you got to know, is going on because every scientist knows that a better way to immunize is not injecting people. Instead, like with polio now, sugar cubes and a drop of the vaccine for little babies. So that was the great news of the week. Overall, just to end this, our trends are all down for all of the major infectious diseases. There's only one disease that's going up right now, and that is our old friend, the cruise ship virus, which is the norovirus producing vomiting and diarrhea across a 24-hour period. And some of you may have a story to tell about that because it's affected a lot of people. And this is fortunately not a serious virus. It's very uncomfortable and it's very infectious. Prevention of it is around staying away from people who are sick and washing their hands very well. And if you happen to be the one with vomiting and diarrhea, that you don't make places dirtier for other people to come in and catch your virus, your GI virus. So that is really good news that norovirus is the worst of the contagions that we're focusing on. Another little piece of good news is China has had no significant variants show up in their current COVID outbreak that they are experiencing. So the Chinese and everyone else looking in China to see if there's new variants that are being produced in the ill individuals there, and they're not finding those. So at the end of our presentation today, we spent a lot of time looking backwards and then understanding the news as it's going to come out. There will be, just as there were at the front end, some reports that conflict against each other, and over time we play out, did this bug come from a lab, did it come from an animal reservoir, etc. There'll be a back and forth on that, and eventually we'll have enough of these agencies that have done investigations and produced reports that we'll be able to get a much better idea. And the focus again is how to prevent it from occurring in the future to create another pandemic. And then our focus now is, in terms of COVID, watching for more variants, and it's good news that we don't have any more of those being reported. And then looking for vaccinations that'll fit into our ordinary vaccination patterns, which may include, again, something that goes in your nose, sprayed in your nose, or something that you swallow. That would be a little more comfortable way of getting vaccinated to COVID in the future. So enjoy spring. We're a couple weeks away from that spring equinox. Always a great time of the year. Stuff's beginning to bud. I'm sitting in a place now where the yellow storm is occurring. And for those of you who know about yellow storms, that's when all the pollen comes out to the point where it coats all of the cars in a beautiful yellow glaze and won't come off until you wash it off. And then the streets, it blows around like a little yellow storm. So that's what that's about. So allergy stuff coming around now. Have a great spring. I look forward to talking to you in a couple of weeks. Take care of yourself. DocTalk, beginning of March.